Good morning, students. Am I audible?
Good morning.
Good morning, ma'am.
Yes,
That day you got PPT? I
Yes,
have
ma'am.
sent in BSc Nursing group. Have you download?
Yes, ma'am.
So have you gone through the content? Read out क्या है कि नहीं content?
Yes, ma'am.
Understood or any doubt is there? When all of you will come to the college from December month, that time again I will explain by face to face. Okay. Now though it is not possible, so I am taking in online. When we'll meet offline, I will explain it against one. But you have to go through the content, then it will be more clear. Understood? So then I'll start. Already 30 participants have joined. So many things we have discussed in nursing as a profession sector. So what are the qualities of nurses? What are the function of nurses? What are the professional aim and objectives, everything we have discussed. And where you want to work as a clinical setup or in a college setup, so that category of nursing also yesterday in class I have explained. So now today we'll discuss another one important thing that is to come in exam. Have you seen the slide?
Yes, ma'am.
Okay,
Yes,
why
ma'am.
it is written scope of nursing. So why all of you chosen this nursing profession? Do you have any idea why you have chosen? Because there are some scope, there are some opportunity, future opportunity. You may be benefited from by studying this nursing course. So what are those scopes? Why you have joined this profession? Always we prefer such a course, not only nursing, other courses also, when there are some benefit is there in future. So what are those scopes? I already explained in previous classes also. Do you have any idea what are the scope of nursing? I already explained. Are you able to catch last my classes? Then you are able to answer my question. So now I have said already, now you are joining as a BSc nursing course. After that, you can go for further study, that is MSc nursing course, right? Then you can do the MPhil, PhD, post basic nursing, those who have done GNM course, or some special categories of nursing courses are there. So these are the scope. It's depend on your interest. You can join in any side of nursing. So these are the scope of nursing. Let's see. So nursing is a healthcare profession focused on the care of individuals, families, and communities so they may attain, maintain, or recover optimal health and quality of life from birth to death. So you are not only giving care to the sick person, that sick person is related to someone families, or you are working as a community health nurse or PhD health nurse courses. So while you are doing community health nurses, so directly you are related to the individual's family and communities. So that is very important. So nursing, your profession is caregiving to the patient as well as it is related to their families and communities, and your services is very important. It's related to human life. So have you seen this photo before? Anyone?
Yes, ma'am. Yes, ma'am. Same.
Very good. Who is she?
Ma'am,
She's
Nightingale.
Yes, full name.
Florence Nightingale.
Very good. Florence Nightingale. She is the founder of nursing. How this nursing came, that history I will take another classes, but now it is important that something which we should know about her. She is the our pioneer. See, Florence Nightingale, a celebrated English nurse. So students, still now you are joining. Why you didn't join in time? So she is a writer, came to prominence for her pioneering work in nursing during the Crimean War, where she tended to wounded soldiers. She was dubbed the Lady with the Lamp. After her habit of making round at night, she laid the foundation of professional nursing with the establishment in 1860 of her nursing school at St. Thomas Hospital in London, the first nursing school in the world. So Florence Nightingale I think in history you have found that during your class 9-10 Crimean War. About Crimean War, that time what happened there during Crimean War, so many soldiers were injured, sick or died. So that time she has observed that many soldiers has died not because of because of infection, because of unhygienic, because of poor environment, because of poor food diet. So see what she did. She with her friends, with her some close friends, she visited the hospital at night time with the help of a lamp. That's why Florence Nightingale is known as Lady of Lamp. That time what she did, she take permission from the government and provided nursing care to those patients. She has observed that many people are in hospital with the same cloth. 3-4 days, 5-7 days patient are there, they are same blood stain cloth they are wearing. From that cloth infection growth, their bedsheet had never sensed, their food is not maintaining hygiene, then drainage system is not proper. So what she did, she cannot give the treatment. What she did with her friends, she provided the nursing care to those soldiers. After giving the services, then she has observed that mortality rate has reduced. That means death rate is become reduced. After that, she find that if along with the treatment, if we will provide the nursing care, then there will be the mortality rate will be the less, and people will be recovery fast. Understood? So what she did, she opened one nursing school. First, she has established one nursing school where in London at the year of 1860. This is the first nursing school. Understood, student? All of you understood?
Yes, ma'am.
Okay, so these things are
Yes,
very
ma'am.
important. How this Florence Nightingale has developed the school of nursing, why these thoughts has come to her mind. After this Crimean War, only she is found that only nursing along with the treatment, nursing care is very much essential for recovery of the patient. Next is what are the scope? So you see, I have already said general nursing or midwifery. That means GNM courses, 3-year GNM courses, basic BSc nursing courses. Here you have joined these courses, BSc nursing courses, you have joined already. And those who have done the GNM courses, after that they are planning to do the higher study, they have to do the post-basic BSc nursing 2 years courses. Yesterday I explained already. Then master in nursing. While going through these 4-year courses, you will find different subjects. So based on your interest on that particular subject, you will do the master degree. So I have done master degree in obstetric and gynecology. Maybe you have interest in medical surgical nursing or community health nursing. So depending on your interest, you can do one subject, MSc nursing. After completing MSc nursing, there are so many diploma or certificate courses are there. Suppose you want to do 6-month training in ICU setup or OT setup or burn care setup, or suppose your cancer institute, some chemotherapy setup. So many things are there, certificate courses are there. If you are interested, you can do those courses. Also, you will get job easily. Then at the end of these courses, if you are interested, you can do the PhD in nursing. PhD means you have to do a research, scientific find out on a particular topic. That is called PhD in nursing. So if question is coming that what are the scope of nursing, first you have to show there are a lot of courses like general nursing and midwife, basic BSc nursing, post basic BSc nursing, master in nursing, postgraduate diploma or certificate course nursing, and PhD in nursing. Next come, nursing profession is great to be considered as you will. Why you are considering nursing profession is the best? profession. Let's see. Directly influence the health and well-being of other people. You are directly related with the patient care. Your support, your health education will recovery from the patient from illness. So that is very much humankind services. Never stop learning about health, about illness, about people and the world we live in. So you are dealing with the patients mean day-to-day life. You have to know that so many senses, so many new techniques will come out while you are delivering the services to human, so that also you will be become up to date of your knowledge. You will have a range of careers role in one. As they develop, you can diversify and specialize. Excellent career opportunity. So wherever you want, you can work. Suppose after completing BSc nursing, I am not interested to do in nursing profession, I do not want to join, let me do some another opportunity, like I want to do MBA or I want to do some bank services or whatever maybe. Suppose your mind has sense. So this degree certificate also having, you can apply those courses. No need to read again general art science courses and apply for these courses. This degree certificate is equivalent to those certificates. So you have lots of opportunity. Now see, nursing is a great profession, very much in demand today. You know, this is the only profession after pass out immediately, not even pass out, before pass out you will get the job. That much demand is there, the crisis is there in the world. Other job after doing first class MSc in first class MSc in subject, or first class in suppose law, any subject, agriculture, you have to search job, you have to give so many interview and all. But this is the only profession before giving the your final result also you will get your job. No need to worry, no need to search anywhere. That's why it is considered is a best job, because in this world, nursing is the only profession where still crisis is there. Lots of demand you have seen. So there is a shortage of 3 lakhs nurses worldwide. In the next 15 to 20 years, this number will be estimated to increase 8 lakhs. So at present scenario, 3 lakhs nurses crisis is there. So that's why I said that as soon as you complete your course, immediately you will get a job with a good salary. So nurses have one of the most secure job you can have. You touch souls and sense life. That is obviously we are dealing with human life. We are by providing the support care, we can give the life to the needy people. Now, nurses work in a large variety of specialties wherever they work independently and as part of a team to assess, plan, implement, and evaluate care. Nursing duties are manifold and cover a wide range of function and responsibilities that depends with the level of qualification and the working environment. As a nurse, whatever care you are giving, it should be based on evidence. Evidence means proof. So after giving care to the patient, you have the right to evaluate that I am giving care. Suppose one patient is having fever. So you are giving cold sponging. Before, what happened, our parents, whenever we are feeling, we are having fever, they used to give more cloths. Now what new things, that we are not giving clothes, we are removing the clothes and we are giving the cold sponging. So it will help to reduce the temperature. So it is evidence-based proof that by providing the cold sponging, we can reduce the temperature. So after giving the cold sponging, you can measure the temperature of the patient and you can evaluate that your care can help to reduce the temperature or not. Next comes job prospectus. At the initial level, nurses are required for the bedside care of patient. So yesterday I have said, if you are interested to work in the hospital setup, you have to work in the bedside care. What it is called? Staff nurse. First designation will be your staff nurse. Then while at senior level, they are required to manage special group of people like children, adults, and the elderly, pregnant women, and newborn. As soon as you join in the hospital setup, first you will get the bedside care. That means you have to give directly care to the patient. After working 3 or 5 years, you will get the senior post. That thing already explained. So after when you will get the senior post, that time you are not directly related with the patient. That time you have another type of responsibility. You will have to you will manage the ward, the other person of the ward, the linen, the bed, linen and medicine invent, everything you have to look after for the smooth running of the ward. Now come, they can work in setting like hospital. So where you can work? If you are interested to work in hospital, you can work hospital. Nursing home are there. If you want to join in nursing home, you can join clinics and health department. Suppose doctor clinic and other health department. There also, if you are interested, you can join as a nurse. Orphanage and old age home. Now orphanage, where orphanage, I think all of you know, and old age home. Now old age home concept is very much popular. So there also they need some nurses to take care of the old people or orphan children. So there also you can join as a caregiver. So military nursing. So after completing this course, military nursing, you have to give the entrance. If you qualified or if you pass the exam, you can join as a military nurse, Air Force nurse. So it's everything depend on your likeness. Which side you want to go, you can join there. Community setting, school health visitor. Now every school there is a post for nurses to give care, immediate first aid care to the students. Then other health services. Industrial houses, industry factories, so many emergency accident can happen. There are also nursing posts are there, you can apply. So railway and public sector medical department. Railway also, railway hospital is there, that is central the job. So you can join in railway hospital also. So many opportunities are there. You have to choose which side you are interested to join or which department. So training institute as educator, home care, palliative care, hospice, public health agencies, ambulatory care center, extended care centers, officers, cooperative, health-related industry, occupational setting, mental health services, private healthcare providers, there's a prison nurse, correctional de-addiction nurse, researcher. So many opportunities there. Okay, I will not work in the hospital or college setup. I will do research. Research in some related topic. This is a quite tough. Now you will not understand this topic. Later it will be clear that research is means, so the day-to-day new inventory is takes place because of research. If you are interested to do research, you can only involve in the research. Sometimes what happen, you can take some short courses like mental health nurse. So you can work in the mental health hospital when mentally sick people are kept, or you want to do work in an ambulatory service, or in ambulance you want to provide services. There also you can join public health agencies. Yesterday I have explained that public health nurse. So you are related to the society, grassroots level, rural area. You have to go and provide the services and implement the program. So these are the so many opportunities, scope are there. Now you are new, you are the beginner of the course, you do not have that much idea, but still now you are aware that so many options or scope are there. Depend on your likeness or interest, you may go. But for that, you present, you have to study hard, you have to pass your first year BSc nursing course. Likewise, after completing fourth year BSc nursing course, you may go. If you want to do job, you can do job, or if you want to do further study MSc nursing, that is well and good. First, you complete your qualification, you collect your degree, then you go for job. Next is they can diversify into different areas of nursing practice, operating room, critical care, emergency department. So these are also some area. Operating room means operation room. Critical care room means suppose in ICU and all, emergency department, then mental health department. These are also some department where you can provide your services. So nurses may choose to work in one permanent setting or may take short-term assignment as a travel nurse to fulfill temporary project for nursing staff internationally. They can even serve in key government and elected position, become a nurse practitioner, clinical nurse specialist, nurse educator, researcher, or a nurse manager. As a nurse, the sky is the limit. We said sky do not have limit, but for nursing profession, sky has the limit. Thank you. This is all about your opportunity and scope in nursing. So study hard, choose your, fixed your destiny, your aim, work hard, then you will go for your dream. You run after dream. If you want to work as a hospital setup, work hospital staff nurse. If you do privately practitioner, you can do privately practitioner. Or you want to give nurse educator in the hospital setup, you want to give education regarding disease and all to the hospital students, hospital staff, you can work as a nurse educator. Or you want to work as a researcher, you may go ahead. So this all about the scope of nurses. All of you understood?
Yes, ma'am.
Any doubt? Any student? Any doubt?
Ma'am, ma'am,
Yes?
ma'am, I was asking that if you study in private, I mean BSc nursing, if you're doing private and
Okay.
then you want to join like government,
Yeah.
I mean work for government hospitals, then you have to
Yes.
appear for any exam.
Okay, so now it's not difference. You are working in a government hospital, or that is a good question. You have lots of query. I'll clear you. So suppose you are studying Rahman's college. This is a private institution, and where I have studied myself, that is a government institute. So it's depend where you want to choose. You want to do in a government hospital or private hospital, but the certificate has the same demand because we have the Indian Nursing Council recognition. Government hospital also has Indian Nursing Council recognition and State Nursing Council, and we are also have same that the certificate is equal demand. It's not like government hospital certificate has something special demand, private, no, it is equal. Anywhere you can go. And regarding job purpose, suppose in government sector some courses are opening or job is coming out, then government, those who have studied in government colleges and those who have studied private colleges, both they have to appear interview. If not like that, only private student will give the interview, government student are not giving interview. Everywhere interview is there, but it doesn't mean that only government student will be selected, private student will be not selected. At present, you see, I am studying both BSc, MSc nursing in government college, but presently I am working in private nursing college. So some are working in the private nursing college studied, and they are now at present working in the government college. So it's depend how they clear their interview. So it does not matter any difference. Both government and private student need to appear interview. That is compulsory. Interview is compulsory. Understood you? Clear?
Yes, ma'am. Okay, ma'am.
Any query?
Yes, ma'am.
Anyone? Fatima Begum. Fatima Begum, where you are? Now my class is over. Now you are joining. Fatima, can you hear me? Fatima? Fatima?
ফার্স্ট টাইম গেলে গেছিল এই জন্য মারা গেছে
Okay then student, if you do not have any query, I'll stop here and after that I'll send. Yes?
Ma'am, during BSc nursing job, can you also study the MSc nursing?
No.
মনে আছে
First you have to complete BSc nursing. Compulsory.
Ma'am, she was
No, ma'am,
saying that
during job.
after completing BSc nursing, you are
Yeah.
doing job, okay, and along with job, can you study MSc also?
Yes. Oh no, that you will face problem. See, you have to attend classes. From morning to like now, from 9 to 5, you have to attend college. You have to attend classes. It is not possible. Same time you will doing the job and you will do the this one. study. Once you have to choose. MSc nursing courses is 2 years courses. After BSc nursing, you will do 1 year teaching experience. That is mandatory for taking admission in MSc nursing courses. After that, you do 2 years MSc nursing, then you will do join a job again. No problem. But in study and job cannot you do togetherly. It is not an easy course that it is like a part-time class you will attend, part-time job you will do. It is a full-time course like BSc nursing, same MSc nursing. Anything? Okay, then I'll stop here. Later on, I'll send the slide. Okay. And whatever slide I have shared, so whatever slide I have shared, please go through it. Please, while you are attending class, concentrate in class. Don't talk with. Who is talking? Who is talking? Okay, anyhow, study hard and first you try to complete your BSc courses. After that, you will go for further study. That is very important. If you have qualification, education, you can do anything in your life. Because now you are very young, lots of time is there. Thing is that first you give stress in your present year, first year. Likewise, slowly, when you will complete BSc, then you will work for 1 year, then we will go for the MSc nursing. How far do you do further study? You will be more benefited, opportunity will be more. Understood? So, okay. Thank you, students. And all of you send your roll number, not name. Roll number you will send those who have attend classes. 36 students attend classes. So all of you send your roll number.
Okay, ma'am.
Okay, thank you.